Hello and welcome to yet another episode of Dr. Sin. This is me, Naina, with you. Today we are going to discuss about diabetes, and we have with us Dr. Sreejith N Kumar, who is going to talk more about it. Let us welcome him to the program. Welcome, doctor. First of all, we would like to know more about you.
I'm practicing mainly medicine and diabetes. I specialized and branched out in diabetes over the last few years. And so primarily I'm a clinician treating diabetes, and also we are trying to do certain activities to prevent diabetes. We are primarily concentrating on educating on diabetes, both to prevent as well as to treat. Then I'm also involved in certain other activities like in the Indian Medical Association. I'm currently the chairman of the research cell. I also do some programs on television and some other health education activities.
So can you tell us more about diabetes?
Diabetes has become very common. It affects almost every house. There is no house which does not have some relative who has diabetes. Either the father, mother, siblings. So someone in the immediate family has diabetes. It's true world over, and especially in India, and especially in Kerala, the diabetic population is growing. So earlier, probably it was a disease of an individual, or maybe a disease of a family. But now it's a disease of the society. Almost everyone has it. Diabetes simply means increased blood sugar. We all have glucose inside our body. In our blood, there is glucose. And it is required. Just like, a car uses petrol to run. So we need glucose for our daily activities. All our cells need glucose. But usually it is kept within an acceptable limit. Like normally, the glucose before you take any food should be less than 100. And after you take any food should be less than 140. So when these values go before food more than 126 and after food more than 200, we call it diabetes. Now some people may have a fasting between 100 and 126, then after meal between 140 and 200, you call it pre-diabetes. Now why we should know whether the glucose is high or not is because it's just not because, like, if both of us are sitting here, no one will know who has diabetes. Or if you have a crowd of 100, if you ask a diabetes expert, it's very difficult to identify who has diabetes. Some very few people may have certain signs of diabetes. So more often than not, people tend to ignore that because there may not be very obvious symptoms. But why we are scared of diabetes is because if the blood glucose stay high for a long period of time, then it can produce damage in various important organs of the body.
Okay.
Mostly the kidneys, the eyes, the blood vessels, the heart, the brain and the nerves. So it damages all these important organs, and they take place very slowly over a period of time. Maybe it may take 5 to 10 years, 10 to 15 years to develop these complications. And right now, diabetes is the leading cause of, let's say, preventable blindness. It's the leading cause of loss of limb, that means amputation. It's the leading cause for kidney failure all over the world and also in India. And it's one of the most important reasons for a heart attack. So that is why we need to be aware of diabetes. One, it's spreading like wildfire. Like currently we have more than nearly 68 million people in India having diabetes. And it's increasing very fast. So one, it is affecting a lot of people. And two, it produces a lot of complications. And more often than not, it is silent. Some people may have symptoms. The classical symptoms of diabetes are increased thirst, increased urination. You feel like urinating very often, and then weight loss. There are no other reasons, but the person is losing weight. So all these are the symptoms of diabetes, but only around 20 to 30% of patients may have symptoms. So since it is affecting many people in the society, and since it's producing a lot of complications, it's very important that we identify the disease and start taking preventive measures.
What treatments are given for diabetic patients?
Firstly, as I told you earlier, we have these blood glucose cutoff. We have a blood sugar before food and after food. And as I told you earlier, we have 3 sets of patients. One group which is normal, one group which is diabetes, that is abnormal, and one group which is fence-sitters. They are neither normal nor abnormal, that is pre-diabetes. But before we go in for treatment, we should know that diabetes is preventable. May not be in every person, but diabetes is preventable to an extent of around 58%. And people have tried various methods to prevent diabetes. Now, if someone has a family member with diabetes, say suppose a person's father or mother is diabetic, that person has nearly 50% chance to develop diabetes. If someone has both parents diabetic, their chance for developing diabetes is almost 100%. So, family history is a strong predictor of diabetes. If a person is obese, if he weighs more, if he is fat, he is more likely to have diabetes. Ideally, the Indian Council for Medical Research says that the waist circumference, waist means you put a tape around your umbilicus, the abdominal girth, that is called waist. That should be less than 80 centimeter in ladies and less than 90 centimeter in men. So if it goes beyond that, it is not that you have to weigh 100 or 150 kilo. Even if you weigh little excess and if your abdomen is huge, the chance of diabetes increase. So in all these people who have a family history of diabetes, who had diabetes during pregnancy or who had overweight, all these people should undergo a periodic blood sugar testing. And in blood sugar, after you check the blood sugar, the person could be either normal, he could be diabetic, or he could be pre-diabetic. And in normal people and pre-diabetic people, it is very important to prevent diabetes. So to prevent diabetes, what you need to do is reduce your weight.
Okay.
You have to be meticulous with your diet and exercise. It is not that anything which, we usually all of us take, the diabetic also should be. It's just the other way around. Whatever is advised for the diabetic is what the society also should take. There is no discrimination. Because right now what we do is, we eat a lot, we get fat, we develop disease, and then we treat.
Yeah.
So that is not how it is to be done. We should prevent disease. We should know, we should realize that disease is preventable. For that, what we need to do is, we need to do diet and exercise. In diet, what we need to understand is, all of us are living for eating. It is fine. We can fill our stomach. But when you fill your stomach, you should know what to eat, what not to eat. It's just like traffic light. You have 3 lights: green, yellow, red. Green means you can lavish. Those are all vegetables. You can eat in plenty, any amounts, any form. It could be juice, it could be salad, it could be curries, whatever. It could be raw, boiled, whatever. Then fruits. You can have fruits in plenty, not juices, no added sugar. But fruits, if you want to take 1 apple, 2 apple, 3 apples, it's okay. Orange, apple, all these things you can have. So one should try to fill his stomach preferably with vegetables and fruits. Now, yellow light is moderation. You have to cut down on carbohydrates. Carbohydrate means your rice, your wheat, your tapioca, your potato, your tubers and cereals. So all those you have to cut down. You have to take them in moderation. And red light is things which you should avoid. That's fat and sweet. Fat means your mutton, your beef, oil, ghee, butter, all this stuff. And then sweets. Once in a while you take a little sweet, it's okay. But don't make it a habit. Don't keep on indulging in chocolates and all that stuff. So that's how you regulate your diet. So whenever you see a menu, whenever you see a buffet, whenever you see a food, one of these lights should click. It should be when you see vegetables, for example, you are seeing sprouted beans, the green light will flash. You are seeing white rice, the yellow should flicker. You are seeing mutton, the red should flash. So once in a while you can, but not routinely. Then exercise. Exercise is a must. The only thing is that if you don't get air, you feel suffocated. If you don't get water, you get thirsty. If you don't get food, you feel hungry. But the body do not know to express lack of exercise in symptoms. It expresses lack of exercise in diseases. So you may not have a symptom, but still it is very important that you do at least half an hour of exercise every day. It could be walking, swimming, jogging, dancing, playing, whatever you enjoy, whichever time you want. At least 150 minutes of exercise a week. And calories, as I told you, diet to be adjusted. And with this, what you are going to target? You are going to target your abdomen. You don't need any sophisticated machines. All you need is a measuring tape. Measure your abdomen and try to keep it less than 80 centimeter in females and less than 90 centimeter in males. Someone may say that I have a very huge abdomen. Let's say I have 120 centimeter or I have 110. What would I do? You can reduce 2 centimeter. You can reduce 5 centimeter. So it will give a benefit. So try on diet and exercise and bring down weight, bring down waste, and your chances for diabetes can be brought down. With a weight loss of around 7 to 10%, the chance for diabetes can be brought down to around 58%. So that is something which everyone should do, whether you are normal, pre-diabetic or diabetic. Now once you develop diabetes, if at all someone develops diabetes, then initially we again go with diet and exercise. And if diet and exercise is not enough, then we go for drug treatment.
What food items do you suggest for diabetic patients?
A diet or food for diabetic is not different from what that for a non-diabetic. Whether you are diabetic or not, maybe diabetics may have to restrict the fruits little bit, but otherwise they can lavish on vegetables. They, like you and me, have to restrict on carbohydrates, and like you and me, have to restrict on fat and sweets. So, actually the menu which is prescribed for the diabetic should be followed by everyone in the family. It's not the other way around. You need not discriminate. And as I told you, any amount of vegetables in any form. And many people have this illusion that, you can take wheat instead of rice. Or maybe you can take white rice instead of red rice. That's not correct. All those are carbohydrates. Now you will be astonished to know that the chance for increasing blood glucose, that is what we call the glycemic index. When you take some food, how far it is capable of increasing your blood sugar. Apple, for example, I think has a glycemic index of around 26 or 28. White rice has a glycemic index of 100. So actually, one little bowl of rice is actually equivalent to 4 apples from the glycemic index point of view. So people often think that they cannot take fruit, but they take lavish rice or wheat or whatever. Or they substitute rice with chapati. So that is not to be done. Whatever be the carbohydrate, restrict on carbohydrates. Take a lot of vegetables, moderate amount of fruits, little amount of proteins, maybe dal, fish curry, even lean chicken, curry, all that. So these things they can take. They can have clear soups, things like maybe buttermilk, lemon juice without sugar. So all these things can be taken in plenty.
What age group is diabetes most seen?
Usually the diseases which result from bad lifestyle or erratic lifestyle. And what is erratic lifestyle? It's lack of exercise and improper diet, which makes you fat. And once you become fat, the chance for diabetes, blood pressure, cholesterol, all those things go up. It is generally a disease of old age. So when your age keep increasing, the chance for all these diseases keep increasing. For example, someone is 30, someone is 60. The chance definitely for a 60-year-old person is more. But one very disturbing thing is that we are beginning to see more and more diabetes in very young children. Children who are 10 years, 15 years, 18 years, young teenagers, young adults, they are increasingly developing diabetes because obesity has become a childhood phenomenon. Now we force our kids to eat. We have this habit of telling children, don't waste food. And whatever is left behind in the home, we force feed that on children. We are not happy unless he has finished 1 or 2 or 3 plates or bowls of rice or chapati or whatever. That's a very wrong trend. It's a very wrong trend. In fact, kids know what they want. You might have watched kids, they keep playing, in between they'll come, they'll have little something, and then they'll again run off and play. That is how it should be. You eat if you are hungry, and eat until you are hungry. If you are not hungry, don't eat. So, it is true that all these diseases have a chance of increasing with age, but a disturbing tendency is that even younger people are beginning to develop all these problems. So, the more lean you are, the chances will be less. The more fat you are, the chances will be more. And as age keep increasing, the chances for diabetes will be more. And usually it is seen generally around after maybe 40 years or 50 years.
Can diabetes lead to death?
Diabetes in 2 ways can lead to death. One is, diabetes could be fatal. That means it could be very serious. If the blood glucose level rise too high, blood glucose of 400, 500, 600, the patient is in immediate danger of what we call coma, that means loss of consciousness, and various other complications. The second thing is that Any infection, when it occurs in diabetic, it becomes far more serious. It may be a common cold. In a person, in a normal person, it wanes off in few days. But in a diabetic, he may develop pneumonia. It becomes serious. It could be a small, trivial urinary infection. When it becomes serious, it affects kidney. Even a small wound, it could be from a thorn prick. But then, the patient may eventually lose his limb. So, diabetes has this tendency to amplify or exaggerate or accelerate all disease processes. And second thing, more important is, as I told you in the beginning, diabetes keep producing complications inside your blood vessels, small as well as big. Small blood vessels are seen mostly inside the kidneys, the nerves and the eyes. That's why it leads on to kidney failure, eye blindness and nerve failure, or what we call neuropathy. And also it affects the bigger blood vessels, mostly in the heart and brain, leading to heart attack and brain attack. And all these could be very serious for the patient. Often diabetes becomes costly when it is ignored. Now, if diabetes is managed properly, it can be managed very cheaply. As I told you, the initial management is diet and exercise. It will actually, if you cut down calories, if you cut down carbohydrates, if you don't take mutton, beef, actually your cost will come down. So diet and exercise, there's no cost involved. You can do whatever for. But then when you go in for drugs, then, some amount of cost starts coming. But what we need to know is, it is absolutely important. If you ask me one line on diabetes management, if I am just allowed to say just one line, I will say the most important line in diabetes management is diagnose early, treat promptly. Because the first 5 years of treatment is what matters. If you lose the first 5 to 10 years, then even if you treat, the advantage may not be that much. And first 5 years of treatment can actually be very cheap. We have drugs worth 1 rupee and 2 rupee, which can be given for patients in initial stage of diabetes. And if he controls properly, those drugs will be able to control his diabetes for many years later. But if he doesn't control properly, if he goes in for complications, if the blood glucose go too high, then we may have to introduce costly drugs. For example, insulin, one bottle costs something like 150 rupees. One pen refill costs something like 200 to 250 rupees. Newer insulin costs something like 500 to 600 rupees. And the latest insulin costs around 1800 rupees for a while. So it is right there from 140 rupees to 1800 rupees. You will pick and choose what you want. So the bottom line is, if you treat early, if you treat promptly, you'll be able to contain the cost and treat with cheaper drugs. If you ignore, the diabetes goes too high, then you will be forced to use costlier treatment options. And then again, if you develop complications, then treatment starts getting costly.
What are the different types of diabetes?
Commonly, what we have is type 2 diabetes. So when we say diabetes, we mean type 2 diabetes. Almost, let me say around 90 to 92% of diabetics whom we see are type 2 diabetes. But that doesn't mean that all are type 2. There are other forms of diabetes also. The commonest other form is type 1 diabetes. Now, in type 1, usually it is seen in younger children. And the basic difference between type 1 and type 2 is, in type 1, we have like all of us have a gland called pancreas. Pancreas is what secretes insulin. Insulin is what controls the blood glucose. In type 1, there is severe deficiency, or actually in later stages, no insulin coming from the pancreas. And the only form of treatment is insulin. But fortunately, it's a very rare disease. It's a little difficult disease compared to type 2 to control. As I told you, it's usually seen in children, and the only form of treatment is diabetes. But mostly what we see is type 2 diabetes, which usually occur in families where more than insulin deficiency, it is resistance to insulin. The insulin doesn't act. So during initial stages, actually the insulin will be high. And over a period of years, the insulin secretion will start coming down. So it begins as insulin resistance, and later on there is insulin deficiency. That is type 2 diabetes, which is commonly seen, especially in those with strong family history and who are obese. Then there are certain rare forms of diabetes, like diabetes following disease of the pancreas, we call secondary diabetes, secondary to chronic pancreatitis. Alcoholic pancreatitis can, in the long run maybe produce diabetes. Then there are certain forms of diabetes which are particularly seen in certain group of youngsters. It's called MODY, maturity onset diabetes of young. So there are various other forms of diabetes, but all those are very, very few. Usually when we say diabetes, we mean type 2 diabetes. and maybe around 5 to 6% of patients may be having type 1 diabetes.
Doctor, lastly, what advice you would like to give diabetic patients?
The one line message is detect early, treat promptly. So someone doesn't check the blood sugar at all, and accidentally it gets detected somehow, and then he starts treating. That's not correct, because he may have already had diabetes for maybe 5 years or 10 years by the time you detect it. So the advantage is already lost. We have very elegant studies available saying that if diabetes is diagnosed within the first 1 year, and if you properly control for the first 5 years, you are almost out of danger. So it's very important that you check every year, at least once a year, the blood sugar, especially if you have, as I told earlier, a strong risk for diabetes. Like if you have a family history of diabetes, if you are obese, if you have some other disease like pressure, cholesterol and all. So all these people should check at least once, and if you are overweight, you should check at least once a year for blood glucose. And if you find yourself in the pre-diabetic range or in the normal range, then still be very meticulous with diet and exercise and try to prevent diabetes. Keep your waist as low as possible. And if you have developed diabetes, then don't waste any time. Start treating right from onset. It may be just diet, exercise, it may be one of these drugs added to that, but try to keep your blood glucose as normal as possible.
Thanks a lot for being a part of our show, Doctor.
Thank you very much. Thanks for this opportunity, and I hope this message reach all our people, and we will be able to prevent diabetes in the vast majority. Thank you.
So that was Dr. Sreejith with us. Until we meet next time, this is me, Naina, signing off. Take care.